The essentials that were promoted and brought forth to the AACN are a document that really provides us with a framework for the future of nursing education. And it's a really exciting time to be in nursing education because of this kind of revolution that's, in my view, needed to occur. One of the things that is really exciting about this work is that it creates 10 domains of knowledge. And knowledge, of course, is not the only thing, but there's skills and competencies and attitudes and all these things that go along with these domains of knowledge. And what it does is it provides clarity for nursing faculty, it provides clarity for our practice partners in terms of what they can expect when any student from a school of nursing is graduated, whether that be at the entry level or whether that be the advanced nursing practice level. They have a clarity around what competencies this nurse will come with, what knowledge, what skills, what attitude, what abilities the person will have. So I think that's really exciting because one of the things prior to this implementation that I think we heard a lot about was, what do you really get when you get a nursing school graduate from all the different schools that exist across the United States? And so if you begin to think about it in terms of more of a standardization, I guess would be a word that I would think about, of, graduates will have unique individual learning experiences, and different schools of nursing may emphasize different things in their curriculum. But for sure, everyone will graduate with these domains of knowledge and competency in these domains of knowledge. So they're divided into the generalist practice, entry into practice, and the advanced nursing practice level. It's in the sub-competencies, which are subcomponents of the competencies, where the differentiation occurs between entry into practice education versus advanced nursing practice education. So I find it exciting in that way. I also find it exciting in the sense of the very first domain, which is an area that I think is critical, is the nursing knowledge that underpins our practice. It's the part that's unique and sets us apart. We have a long history dating back to Florence Nightingale, Mary Seacole. These are founders who in the beginning began to talk about the importance of whole person care. That would be mind, body, and spirit, that it's not merely physiological, that there are other components that one needs to consider when we consider a whole person. So I think that's really critical, and that's the foundation from which this builds in domain one. That we focus on well-being, that we focus on human in the context of their environment, because we know the environment influences the human being and health outcomes, as well as disease prevention, all of those different things. And that we promote caring, compassionate relationships, person-centered relationships, and that we are also promoting healing. So I think that based on that foundation, and then you work out from that with these other domains, you have a real strong foundation for what distinguishes nursing in terms of its essence as a discipline and a profession. We are all in healthcare working toward the good of, society, working toward the good of healthcare. But I think one of the things that's really great about this work is that we are really lifting up and clarifying the role that nursing plays in somewhat of a unique manner based on that foundational nursing knowledge and evolving nursing knowledge. So for all those reasons, I think it's an exciting time that the essentials are here in a new way than they were prior to the rollout of this. And it gives us an opportunity to really think deeper about who we are, what type of graduate we want, what type of nurse do we want at the end of this process, and then how do we move through with our curriculum revision, how do we move through with getting resources and understanding in a deeper way what competency-based education is in its most robust form. So in our school, we are using standard structure committees to do the work of the curriculum revision. So this started last year at St. Louis University. We have a long tradition of innovation in nursing education. We've been around since 1928 and have been on the forefront of innovation in nursing. And so I think that our faculty are a part of a culture where innovation and thinking about what's next is part of how they think. We used our existing structure, so with leadership and direction from myself as dean, saying this is the future, this is where we're going, and this is what's required, working really closely with the Associate Dean for Undergraduate and Pre-Licensure Education and the Associate Dean for Graduate Education. Also some discussions with the Associate Dean for Research, but when we think about curriculum, mainly the two Associate Deans for Education. And we have existing structures within our university program for undergraduate and pre-licensure programs, as well as in our advanced nursing practice program committees. So that committee structure actually provides the way in which we get the work done. Coordinators of different specialty programs at the master's level are really involved in this process and working with the faculty, as well as in our undergraduate space, in our traditional BSN program, our accelerated Bachelor's of Science in Nursing program, and our RN to BSN program. So the faculty have really done the work. There's been a lot of leadership in terms of, as I said, the associate deans just framing things for people, but really faculty driven when it comes down to the work that we needed to do. So we've moved through the curriculum mapping process across all of our curriculum and our programs, knowing what is in the current curriculum and the extant curriculum, and comparing that to what we need to have in terms of the new essentials. Identifying gaps where we did not have things as covered as well as we should, and then beginning to map out what courses need to be revised. We're down to that level now where we're beginning to think about course syllabi and how the curriculum revision will actually play out and the processes and structure that's needed for that. We also are thinking about the larger ideas that we need to look at in terms of competency-based education. So that's another iteration that will come later, is really thinking about how we drill down to really understand competency-based education, what it's going to look like in terms of simulation experiences, what it will look like in terms of practice experiences, experiential learning, didactic and theoretical content, and how we will be able to measure that through different assignments, different activities, maybe different reflective activities, different types of formative evaluation, self-reflection, so that a student has perhaps a portfolio of sorts when they graduate that really allows the competencies to show up in terms of what they know and what they're able to do with what they know. Tools and strategies that I think have been most helpful, of course, discussion is really important. Being able to wrap your head around what we're being asked to do in terms of the conceptual content is really important, I think. And learning more about what the essential changes mean has been facilitated by AACN, who has developed webinars, which we've asked our faculty to attend in addition to the discussions we're having. There are learning tools that are available on the AACN website. For example, curriculum mapping tools, which are very helpful in terms of doing the curriculum mapping. At the advanced nursing practice level, there are crosswalks with standards that are out there for nurse practitioner education that begin to help you visualize how to map what's current in terms of content and curriculum with standards that need to be in place for nurse practitioner education, and also specialty certification within the criteria for that. So all those tools are very helpful. Just as of about 2 days ago, there are searchable databases within the AACN website that was launched related to different tools and that you can access related to these 10 different domains of knowledge. So all of that's very helpful. I think calling in consultants to work with the faculty is another one. We have not done that yet at St. Louis University School of Nursing, but that is something that's on the docket and being explored. So I think there are multiple ways to enrich the conversation and the thinking that goes into such a major revision. So our practice partners, our main practice partner at St. Louis University is SSM system, Sisters of St. Mary. There are other also systems that we are engaged with. We've started the conversation with the SSM system, with chief nursing officers, at least some of those, not the entire gamut of the SSM system chief nursing officers, But we do have meetings on the book for October and November for this very reason, to begin to talk about a number of issues, one of which is this curriculum revision and what it'll mean in terms of the practice partners. I think it's absolutely critical that this be a co-created process between the practice partners and schools of nursing. So one of the things that will happen is branching out beyond just one system to thinking about all of our clinical partners and how they could be a part of this. One thing we recognize is that working with our adjunct faculty and preceptors in clinical settings will be essential. So while our faculty who are full-time may be cognizant of, aware, and really deepened in their knowledge of what this means, we'll have to extend that out to others who are not full-time faculty, and in a similar fashion to how we would have to do that for practice partners, so that we all are on the same page.